Okay, so good morning, everyone, and welcome to the LAN 53 National Providers Networking Meeting. It is definitely an honor to have you guys with us this morning. Normally, we have our fantastic host, Suzette Logan. She's not able to be with us this morning. She sends her love, and we're going to get started. So, this is Women's History Month. And so we wanted to make sure that we kind of talked about some of the things that are pertaining to women. And we are very excited to have Dr. Twin Green with us today. She's going to be our featured speaker, which I'm really excited about that because Dr. Green is one of I don't know if you're one of the founding members of LAN 53, but definitely one of the members that is in my personal history. So I'm really excited to have her to join us as well today. And so, as usual, what we usually do each morning is kind of get started. We do introductions with everyone and just kind of tell who you are, a little bit about where you're from. And I know, Dr. Green, you're going to be presenting and having a more formal introduction. So we'll kind of save you to the last. And so I'll just kind of go around. First of all, my name is Kimberly Haynes. Most of you all probably know me, but I am the Executive Director of Family to Family Federation for Children's Mental Health. We are a family-run organization, and I have been convening the LAN 53 meetings for the past few years. I've been with LAN for probably 20 years, but I stepped into the role as convener about 3 or 4 years ago. And LAN 53 covers Bloom, Bremen, Rich, and Thornton townships. And so our role is to collaborate with the Illinois Department of Children and Family Services to really kind of take a look at the disproportionality in the child welfare system. It's probably no secret to everyone that our Black and Brown children are being removed from homes at a much higher rate than their counterparts, and at a rate that's really disproportionate to their actual numbers. So we host this meeting once a month for the purpose of bringing together providers, stakeholders, and advocates to share information about the organizations they work with, about the services they provide. And it really has become a space where people are able to network, to make connections, to build collaborations, and hopefully to strengthen their services. So I have a few more announcements that I'll do a little bit after we let everybody else talk. And so I want to now pass it on. I'll pass it to Kara.
Good morning, everybody. My name is Kara Wright. I am a research assistant with UIC with the Permanency Enhancement Project. So I work with different lands across Cook County and love working with Land 53. Do you want me to pass it on or?
Pass it on, please.
I will pass it on to Kristen.
Kristen.
I
Okay, well, let's pass it. I don't know if Kristen's ready. We'll come back to her. Let's pass it to Dr. Stanberry.
oh hello.
Okay, you ready, Kristen? Go ahead.
Okay. Yes. Hi, my name is Kristen Hadley. I'm the founder CEO of I Love My Service CP and ADHD networking group. We are a networking group in the city of Chicago, deal with people with all kinds of disabilities. I'm also a member. I'm also over the disability advocacy department. I am also a lion.
Thank you, Kristen, and welcome.
Yes,
Can you see who to pass it to next?
you're welcome.
Okay. Let's pass it to Kelly Jones.
Good morning, everyone. Thanks, Kristen. Um, and Kimberly, I am Kelly Jones. I'm a health educator with Cook County Department of Public Health in Community Engagement and Health Education. Good to be here. I'll pass it on to Marlo.
Good
Kelly.
morning, everyone. My name is Marlo Ingram. I am the author of the book Scarred, and I also am an affiliate with Family to Family.
Thanks, Marlo. Pass it on.
Um, let's go to what's that? Eve Williams.
Okay, Eve.
Hi, my name is Eve Williams. I'm the CCBHC Project Director with the Lincoln Option Center. So I work with Dr. Green, and we offer services for mental health and substance use treatment. And we serve those regardless of their ability to pay, their age, or where they live.
Thank you, Eve. Pass it along.
Tila Mims.
Tila's on the move. Hey, Tila.
Good morning. Good morning. Good morning. I am Lion Tila Mims. I am so grateful to be here. I am the founder of the Reading Circle for Toddlers and am really active with the LAN through Kimberly. I want you to know that she is such a phenomenal woman. I can't wait to meet the woman that helped her become a phenomenal woman. So I'm grateful to be here.
Thank you, Tila. Yeah, I see you're on the move. Can you pass it on?
Sure. Let's see. Hold on a second. I'm going to pass to. Did Monica go yet or Marla?
Monica didn't go yet.
Great. All right,
Hi,
Monica.
everyone. Thank you. Thank you so much. Hi, my name is Monica Whitaker, and I work for the Department of Children and Family Services in the Resource and Recruitment Unit. And we basically recruit for foster parents.
Well, welcome, Monica. Now, are you coming instead of our girl who just retired?
Yes.
You know, you all know y'all be, yeah, you know you all be over there retiring. Thank you, Monica, and welcome.
Thank you.
And I don't know if you can see on screen. I think we have Dr. Herman Stanberry to go, and then Dr. Twin Green.
Okay, I'll pass it on to Dr. Herman.
Good morning, everyone. I'm with the United Evangelistic Consultant Association. Good to see you guys on camera this morning, especially Kim. God bless you, Kim and Carrie. Y'all have a good day.
Thank you, Dr. Stanberry. And Dr. Green, you want to give us a little snippet of who you are?
Good morning, everyone. Such a beautiful day. We had some snow. Haha. Right. Unexpected. But yes, thank you for putting this back together, Kimberly. You know, we have some history together, and
Yes.
it's a wonderful day to see your face after all these years.
Yes.
I am the founder, president, and CEO of the Lincoln Option Center. And the Lincoln Option Center is a 30-year legacy organization, primarily focusing on mental health, but also medical services. And we're in the South Suburban Cook County area, all of the 38 communities in the Southland, plus in the city of Chicago we cover. And I will save a lot of the other for later in my presentation, but it is a great day to be here. Thank you.
And I'm so glad that we reconnected as well. So thank you for being part of our little group today.
Yes.
So before we get into Dr. Green's presentation, I do want to share a couple of updates with respect to things that have been going on with the LAN. A lot of you all who have been around for a while will know that we've been at this for a couple of years, and it's been a struggle. I know Dr. Green can probably remember a time when money was coming into the LAN, and it really helped to facilitate things like wraparound services. We were able to fund organizations. And one of the things that really is near and dear to my heart was the ability to really support some of the smaller grassroots organizations. And I'm a big, I love to tell the story of how so many resources were available in the community. And it wasn't just the large organizations. There were a lot of people who were just starting out in this field. We had a lot of college students that were really eager to come out and be part of the community and to do work. And it really put us in a position that we were almost able to meet the needs of anybody who came through, regardless of what their interests were, what their issues were. We were able to match families with services. And it really has been something that has been important to me, to see that come back, because I have nieces, great nieces, and grandkids and things that are now coming up and going through these same blocks. So one of the things that we did through the LAN was we were able to work with UIC to start actually looking at the data from DCFS, to look at what's really happening in LAN 53, especially since we're one of the larger service areas. And one of the things that really spoke to us was the difference between uh, reports coming from our schools, reports coming from law enforcement and other reporters, and the accuracy of these reports. And one of the things that was an immediate concern to us was the number of reports that are coming from the schools that are not founded, and really just thinking about the traumatic experience of having DCFS become part of your life, right? As a child, as a parent, and kind of just wondering like what's going on with that. So we started a mandated reporter group to kind of delve a little bit into this issue. And what the group is working towards is really delving and getting more information, right? Trying to figure out like what is the challenge for reporters? Are they having any sort of issues, and what kind of support could we possibly look at providing them as a LAN? And so there is a survey that I'll share with you all. We're trying to get at least 100 responses back from people who are designated as mandated reporters, so that we can start getting a little bit more information and insight into the issue. The mandated reporter group actually meets the Monday before each meeting. Okay, so I will be able to share the survey with everybody, and I'm asking if you have your own networks, if you can share it with your staff, to help us kind of get those surveys in. And we really want to try to have that data for the town hall. Now, with respect to the town hall is going to be on May the 5th. And it's going to be at the UIC campus on South Halsted, right, Kara? Okay. And
Yes.
so it should be a really good event. We are saving space for about 100 people. The target audience is all of the LANs in the Chicago and South Cook area. So this is going to be open to all of the LANs. And really what it is they've had these town halls downstate in an effort to sort of revitalize the LANs. We probably have one of the most active LANs, and we have a low turnout today, but normally we have about 15 to 20 people on the call. So we've been going strong. So we've been hosting this meeting the third Thursday consistently. And a lot of other LANs are starting to come around. There's a big push from the state and the county with respect to taking a second look at these community organizations. And then one of the challenges that we have in the Southland is that there's a million networks and groups and committees that are just siloed. So we're really grateful that this thing is coming together. And I really want to encourage everybody to come out to participate. The agenda seems to be really engaging, whereas we've got a couple of speakers. One is Dr. Dana Weiner. Dr. Dana actually presented for us last January, I believe, because she's representing the governor's office for behavioral health, the Behavioral Health Transformation Initiative, and they are looking to invest into some restructuring of the community networks. If you guys know, all of the agencies have different maps, right? There's an IDHS map that says you're in this region. Then there's a DCFS map that says you're in this land. Then there's this behavioral health transformation map that says all of these people are in this region. But the reality is that there is a movement to come back to what I think they know that works, which is really investing in the local community infrastructure. And she really had a lot of good information about the resources that we can expect to tap into from the governor's office, as well as we've got some other speakers that are coming. And I'm sorry, Kara, I don't know if you can rattle off the names of the speakers. It's on the flyer. So I shared the flyer. And so one of the things that they're looking to do is to make space for the LANs to get together during this town hall and sort of talk about some of the discussion items and really start to get some action planning going. I know for us in 53, um, I'm always on the hunt for people who would love to share this leadership. Normally, we have 2 conveners for LAN. Right now, we have 1. I'm definitely open to anyone who was interested in being a co-convener and really kind of bringing us back online to the structure that we had, several years ago. So I will also share the link for that town hall meeting. And like I said, it's open. I would encourage if you have colleagues that you can send, and even if you have some family members who you think might be interested in becoming a little bit more vocal in their advocacy, making those connections and getting a little bit more involved. I can tell you, I started as a frustrated parent. I had no idea I would be doing this, 20, 30 years later. So we definitely want to make sure that we involve our parents. So those are the 2 main announcements that I wanted to share. Does anybody have any questions about the work group or the town hall meeting? Okay. So now we get to the main event. And so it's my honor to introduce Dr. Twin Green. As she mentioned, she is the founder, the president, and the CEO of the Lincoln Option Center and a leading figure in mental health. The Lincoln Option Center emerged from a very personal journey for her that began back in '94. And through her own experiences as a mother, she recognized the critical gap in the community resources in our South suburban Cook County area. And, I think, her commitment to turning her personal struggle into a source of support is what led her to the establishment of the Lincoln Option Center. And as she mentioned, this is a 30-year legacy organization right in our own backyard. Lincoln Option Center is also listed as a Joint Commission accredited certified community behavioral health center. And she has 4 operating locations in the Southland. And so I am pleased and very honored to introduce to you all Dr. Twin Green from the Lincoln Option Center.
Thank you, Kimberly. I don't need to say anything else, do I? So yeah, I am Dr. Twin Green, and again, it is my pleasure to be here and to be recognized as empowering this month of March, which empowers women. So I don't take it lightly when people even give me the opportunity to share what we have to offer, not about me, but what we offer the community, and hope that we can continue this legacy for many more years to come. I am one of the founding members of LAN 53, and it was a journey. That time, providers coming together, routinely talking about the needs of the community, and just, with limited resources, very, very limited resources. The monies that came, to LAN 53, it really didn't do a whole lot, but we made it do what it needed to do. And because we had organizations that were committed to the work. And we put our own resources into it and our time. And the communities down here are better off for having it. And I want to give credit again back to Kimberly for not leaving that mindset and staying focused on the needs of the Southland, because we know that this is an area that has been underrepresented, underserved for many, many years. I'd call us the stepchildren of the state of Illinois in some respects, because we are. So I am always fighting on behalf and for on behalf of people that need these services, and to give more recognition to our needs. We have so many entities that are focused on doing community needs assessments, and we get those needs assessments and they say the same thing every year. And we're always in there with the high need, recognized as a high need area, but then we don't get what we need to have down this way to make that difference. So staying in the struggle means something. Staying in the game means something. And so we're not in it to quit, we're in it to continue to do what we do. So I'll just share a few things about the organization and what we do offer, so that you'll be able to remember these things and utilize them as you have a need to do so. Last year, well, I'll start with the agency started off as a youth services focused organization. We ran after school programs. I came out of corporate America at Cillian Austin Law Firm to start this organization. And as Kimberly said, because of the personal experiences that I was having with my own child. He was intentionally trying to be a menace to society because I divorced his daddy and he didn't like it. And detachment disorder set in. I had no idea what that was even about, because I was not in this space back then. I was in corporate America, working for one of the most prestigious law firms in the country. And I knew that my son at the age of 9 needed to go to school, and he needed to get an education, and I needed to get to work so that he can have those things that he needed. But his heart was all about being with his father. He loved his mother, but he was in love with his father. And that separation did something emotionally to my son. And I today understand it, but I did not understand it then. So fast forwarding that situation, I am very passionate about what it is that I do. And I am that mother that I look at every day that comes through my agency. And I am intentional and passionate about making sure that when people come through my agency, they are not viewed as a number. They are connected with the resources that they need, because I did not get that when I was seeking help. The community failed me and left me to figure it out on my own. And that was not a good place to be at that time. And so I know what it takes right now to make sure that people have what they need, and to feel that they're getting it from whom they want to receive it, where they want to receive it, and they're feeling good about it. So that makes all the difference of how you deliver services to people. They need to know that you care. So we, after coming off of being a youth services focused agency and running a teen reach program for 10 years, the first of I think it was in 2000, Teen Reach, the state of Illinois, created the Teen Reach After School program. And I had over 100 kids every year. For 10 years, I did that. Kids coming from grammar school, coming from the high schools, latchkey kids. We fed them. They had, all the academic supports that they needed. Mom could go to work or dad could go to work, knowing that after the school bell rang, we had their kids in our care, and all they had to do was to come and pick them up on time at 6 o'clock. And they had good food to eat. The Chicago food depository, made sure that we were able to feed our babies. And we did that, and we loved what we did for those 10 years. But then our babies would come in and share what was going on in their own lives, in their own homes. And kids will talk. And so in their sharing of their disappointments and their needs, that created the opportunity for the Lincoln Option Center to decide that it wanted to do more than just focus on youth, but we needed to focus on that whole family. And we then became a certified community mental health center, CMHC. So focusing on mental health services, addiction treatment services, and case management services. So then we did that for 29 years. And then last year, we were given the opportunity to apply alongside the state of Illinois for the demonstration for certified to be a certified community behavioral health clinic. And this Medicaid demonstration application was very rigorous, and 19 providers across the state of Illinois made the cut. And I don't remember how many had applied, but it was to be put in this space right now is it's an honor and a privilege, because what CCBAC brings to the table, it is unlike anything that has ever been offered to the community. Number one, it gives people the opportunity to receive care, access to care immediately within on same day services. That's unheard of. There is no wait list with CCBAC. The other thing, regardless of your age, we have to make sure that we are servicing you, babies all the way through senior age, regardless of where you live and regardless of your ability to pay. So whether you have Medicaid, no insurance, private insurance, whatever it is, we are here to serve you. And the services that everyone is able to take advantage of, I'll list those out for you. So we have 24/7 mobile crisis response teams that go out. And this is 24/7, 365 days a year. We also offer diagnostic screening and assessments, triaging people for risk, outpatient mental health and substance use services, targeted case management, outpatient primary care screening and monitoring, which means that not only are we looking at your mental health concerns, but we're also concerned about your physical and medical health. So we have physicians on our team that are screening for primary care to make sure you're coordinating your care. We're coordinating your care with your primary care physician if you have one. If you don't have one, we're going to make sure that you get one, because we're concerned about your physical health as well as your behavioral health. Sometimes we go and we'll come and see the psychiatrist because we have anxiety and depression and all these other diagnoses and feelings that we're bottling up. But then sometimes anxiety can be because we're painting from something. And we have to realize our body is talking to us. So we want to make sure that we are well all the way around. The other piece that is interesting is community-based mental health care for veterans. And we know that veterans need a lot of care because of the post-traumatic stresses that they endured when they were in combat serving our country. And they need to make sure, and their families, that they are connected to services, and they don't always have to go all the way to Hines VA and they live in the South suburban area. Why go all the way there to get services that you can get here and the same services because it's peer led with veterans as well. And transportation is an issue. You know, how do I get all the way there if I don't have a car? So we provide a lot of different opportunities for you to have access to care. Family and peer support counseling we offer, and also psychiatric rehabilitation services to make sure if you're struggling with employment needs or any of those kinds of situations, social determinant of health needs, we make sure that you're getting those needs met. Coming this August, we will have our behavioral health urgent care center open. And that is a walk-in 24/7 for outpatient services, including medication monitoring. So our staff is huge on the clinical side and the medical side to make sure that people can come in, just like urgent care. When we go to the urgent care center. So it's that, but it's the behavioral health side of care, the focus, but you have the medical side of services incorporated in that. And then we have crisis stabilization units that is pretty much unheard of for behavioral health centers to even operate those, because most times, you know, those are inside of hospitals. But this model that the state and the federal government has put together through SAMHSA, this is what we have to do. And we have to have limited in size, up to 16 beds, so that people can come and stay and get the de-escalation and stabilization services that they need, and they can stay up to 3 to 5 days in range. In addition to that, I am so proud of our Stella doula services program, and it is called Hold Tight in My Mother's Hands. So with that, we have a partnership with Meridian Health Plan, and they have, since last year, have been sending all of their high-risk mothers to us for prenatal and postpartum care. And we have certified doula case managers that work with us. And I believe right now, to date, we may have about 50 moms that are with us. And the beauty of it being connected to our CCBAC is not only are they being connected for prenatal and postpartum care, but all the other services that they may be in need of, making sure that they have connections to the social determinants of health needs, great housing, being able to bring the baby home to a conducive environment. So I can go on and on and on about that, but I love that piece. I love that piece. And then we have our Quiet Storm Crisis Triage Living Room Program. I love Smokey Robinson, so I kind of named it after Smokey with the Quiet Storm. If we have any old school people in on this meeting today. Yeah, I see one. Go ahead, girl. Love some Smokey. Can't get around him. So Kim, you got it too, right? So with that, in our Hazelcrest location, our living room is open 24/7, 365 days a year. That location is right behind, we have two. One is right behind South Suburban Hospital's emergency room, and the other one is right on Kedzie at 175th. So you can walk in, you can call. We have a crisis hotline number. You can call directly and speak to one of our recovery support specialists, or you can come in and stay up to 23 hours. 23 hours. This is for adults, though. Only for adults. Now, if there are any youth that need that service, then they are provided that service at our South Holland location. So we'll be making sure that that we take care of our adolescents as well. and this is for anybody that just needs to take a break from life for a few hours. But we get all kinds, we get people that come in, police bring them to us because we really want to make sure that people are not utilizing unnecessarily our emergency rooms because we have the services that they need when they come to us. Most times when people go to the emergency room, if they're homeless, they're looking for somewhere to be, you know, seeking some safe shelter, or they're coming to get some medication. They've not been on their meds and they want to get a refill on their meds. We do that. We do that. And like I said, and it's a very comfortable environment to be in. We have wonderful recliners, uh, and a space so that you can, it's like a living room. It's just like a living room. And you can have some healthy snacks, uh, sit with someone that has, uh, they're familiar with what you may be going through because it's all about having an experience in mental health. Maybe you may have come in because you're fleeing some domestic violence situation. So, whatever it is, we have our peers that have experiences that can help talk to you about that and help you to, figure it out, get a rap plan done so that you understand what those triggers were that got you where you are and what happens and what you need to do the next time that it presents itself. Uh, and if you're coming in just for some me time and you still have other unresolved issues that you need to address, then our case managers, they're right there to connect you to therapists. They connect you to the other services within our clinic. So when you talk about, Kim, you remember how we used to talk about wraparound? It's
Yeah.
that kind of situation.
Okay.
It's that kind of situation, and it is the best thing that you could have. Um, and we're just so proud to be the first CCBHC designated for the Southland. We're the only and the first in the Southland region. So I am so excited about where we have landed through this journey in 30 years and are more excited about what the future still holds for us. And I encourage all of you to partner with the Lincoln Option Center. Use the resources that we have. It doesn't cost you anything. We have transportation services. I know that all the health plans, um, they do have their preferred vendors that are contracted to make sure that their members have adequate transportation to get to their appointments, but it is not as efficient as it should be. I, on many occasions, have had to Uber home clients because they've been left there at my clinic. And so now we offer our clients Uber help. You know, they're going to get where they need. They're going to get back where they need to get to, and they're going to get to us when they need to get to us. So those are the kind of incentives that we offer to make sure that people are engaging into care and they know that they can have access to the quality care that they deserve to have when they need it. I don't think I left out anything.
Well, I'm gonna tell you, I am super excited, and I think this is a safe enough space for me to say I'm really excited because I think one of the things that we had really been missing in our network and trying to move forward was to have like an anchor provider. And I think we've had some folks from Aunt Martha's on and things like that, but kind of as a throwback to our earlier land days, it's much more comfortable to know who you're sending people to.
Yeah.
Because a lot of times when we're in the space where we can make that recommendation, we've already established a sense of trust. And
Yes.
it's nothing more disheartening than saying to somebody, oh, well, you know what, here, you can go over here. And then they come back and say, well, nobody ever called me back, or, was very cold and unfeeling. And I had to answer the same questions 1,000 times. And, they just, you want people to have an experience that's welcoming. And I appreciate it. And I will say I feel guilty because I didn't know that you were doing all of that. So big ups to you. And I definitely want to do what we can to get the word out. So I do have a question, Dr. Green. So in terms of how we may be able to make referrals to you, is that like a standard process? Do you have like a referral form that we can get out?
Yes, so referrals can be made in many ways. You can actually go on to our website and fill out the referral form right there, and it goes straight to our intake department.
Oh, perfect, perfect.
Or
Now, okay.
or you can call directly into our office. And do you want me to put that information in the chat?
Yes. And then
Okay.
if you guys, and I'll reshare the flyer because it's got a link to your website on there as well.
Yes, yes,
Yes,
yes.
yes. And so so we have a group over at Lincoln School in Calumet City that we work with. And literally yesterday we had just this really long, deep conversation with the group, and this is 6th to 8th graders. And like you said, kids have a lot that's on their plates. And I think sometimes we as adults kind of, dismiss it and how important these issues are in their day-to-day functioning. And one of the things that the group asked for was to have someone to come and talk to them about mental health so that they could have a better understanding. And they have a lot of concern for themselves, but also their peers. And so when you said transportation, I'm like, oh, maybe I could send some of the kids over there, so we'll definitely kind of, I'd love to reconnect offline to see how we might be able to help these young people kind of get to a space where they're able to connect with some professionals to get some of their questions asked. And I am a big promoter of get yourself some therapy.
Yes, yes. And we're going to need a whole lot more therapy. We thought that COVID brought uncovered a whole lot, but in this climate right now, and
Yes.
I didn't want to go down this path in this conversation, but truly, COVID gave us a lot of courage afterwards to address, the issues that we were having, experience our feelings, and dispelling that stigma of I can't get help because I don't want anybody to know what I'm going through. But this is going to be different.
Yes.
This, if God forbid that Medicaid is cut, it is going to be a sense of devastation for a lot of people, a lot of providers that care for the people that are Medicaid eligible.
Yes.
And it's unfair that is across the board. Whatever their intentions are, who they're targeting, it's everybody. So you can't snatch it and think that it's only going to affect so many people. It's going to affect everybody that's eligible. And there are a lot of populations of people.
Yes. Yes.
Across demographics, across political orientations,
yes.
Okay, affiliations. It's going to be effective. It's going to affect everybody, and it's going to get them to a place. If you can't survive with making sure that your basic needs are met, where do you think you're going to land mentally?
Absolutely. And I think, not only just that, but even with these job cuts, you
Oh,
know.
yes. Oh,
And
yes.
and I don't know if anybody's ever had to transition, but Cobra Care is not affordable.
Mm-mm.
It's
Mm-mm.
not affordable. If you went from paying, even $100 out of a check to $300-400, every month for care, and we've seen even with COVID, we saw the numbers of uh, addiction rise,
Mhm.
self-harm rise.
Mhm. Mhm.
And I think that that's another way that we need to be aware of and to be prepared for.
Absolutely. And we are working on that right now because we know that what the influx is about to bring to our agency.
Mhm,
So
mhm,
uh,
mhm.
it's just unfortunate, but what you gonna do?
Well, I would say, we've got an intimate enough group that if anybody wants to come off of mic and join the conversation, we welcome you to do that. I know I definitely want to reconnect with you, Dr. Green, because I think we need you. We need your presence here. We need your presence here.
I'm
Um,
here.
for most of you all that I don't know if you know, but the LAN network has never been structured to provide direct services. But one of the things that we've always been really good at is assisting families and organizations with navigating systems, identifying resources, and making those connections. So,
Mhm.
I definitely want to see us get back to that. And I see Kelly, you have your hand up. Come on, Kelly.
Yes, Dr. Green, good to see you again. I sent you a direct message, but with
I
my email
saw it. I was
address.
about to respond to it. I
That's
saw it.
okay. But I am so interested in hearing about everything that you are offering in the community, which we need to be shouting from the rooftops
Yeah.
because everyone needs to know about it. So I'm really interested in finding out more information so that I can share your information and also see
Great.
how we can partner in order to get more information out. So it sounds
Hey,
fantastic.
Yeah.
right. I'm going to put my information in the chat. How about
Okay.
that? And
Thanks.
then you can send me an email, we can connect and set
Yes,
up
and if
some.
you have any flyers for like your living room or any of
Mhm.
your offerings, that would be great. I host a monthly school health meeting with suburban schools, and my meeting is tomorrow. I'm getting my
Oh,
slides together, so if you have any information to share, I can put that in my slide deck. That would be
look
fantastic.
forward. It'll be there today.
Yeah.
Okay,
And Kelly,
thank you.
send me information. Is that meeting open?
It's catered towards suburban schools.
Mhm.
So I know that you've gotten on before, Kim, and it would be fine to get on as long as you know that some of those I try to have a in service with a community partner who talks about their offerings, as long as it caters towards schools. But then also our communicable disease and some of our other units talk about offerings and it's specific to school. So that's why we try to keep it to school membership because some of these mandates are not for the general community. They're just for, schools. But you guys, I can give you the link, Kim, and you can share it. You guys are welcome to come on tomorrow and listen as long as, you have that understanding about that.
Oh, no, that's fine. Thank you. Thank you so
No
much.
problem. I'll send you that link.
Thank you. And then Monica, I know you are so Monica, do you only gather resources like to try to recruit foster parents, or is this information something that you can also use in your day-to-day? See, Monica's still here. Okay, we'll give Monica a chance to respond. Okay, so I just want to go on and say that Dr. Green, I really appreciate you. I see that Tila has her hand up. Come on, Tila.
Yes. Oh my God. This is amazing. When you say shout to the rooftops, first of all, that you've been here growing and adapting to the market for 30 years, I want to thank you for your steadfastness and dedication to the community. Secondly, um, oh, just a question. So, do your providers do vaccinations?
We do not do
I
vaccinations.
didn't think so because mental health, but you mentioned the public health lens and the
Yes.
way that you've grown.
Yes.
The idea of having a living room Kim mentioned the notion of trust.
Mhm.
That is everything to every stakeholder, whether they admit it or not.
Yes.
And to make a space or to create a space that replicates the safety of home is so brilliant. Um, I'm in a another side of town, and I've seen a group called Turning Point where they're out, the community outreach has got them using a mobile site. So
Mhm.
it'll park in front of the library and people can come in. And
Mhm.
just yesterday, my son, I am a parent with lived experience. I have a now 17-year-old son impacted with autism who is so dynamic. And he decided that he wanted to attend a group at the library where they literally talked with teens about how they questions centered around friendship. But
Mhm.
it was that same concept, you know, a loss of friendship, um, conflict within a friendship, how to rebuild friendships. And um, there was a reference to like coming to the living room of a sort, but it wasn't structured that way. So I just want to thank you for being intelligent enough and having feet on the ground, not being afraid to talk to your people and find out what they really need, and then being committed enough to providing it. Because yes, my son and I are taught, he's nervous about what happens if he loses his Medicaid. And I'm saying to him,
Sure.
I'm creating, I'm creating opportunities and where you'll be able to get some replication
Mhm.
of the services that you're used to. We do therapy like religion.
Mhm. Great.
So we were the easy comers to the
Mhm.
therapeutic concept, but I know from our culture that it's very difficult. You know, I can remember seeing a first therapist based on the trouble I was having with my kid when he was in kindergarten, and I said, "Black women don't go to therapy; we go to church." She said,
Right.
"You are going to therapy if you're going to keep taking care of my AJ." So just to have the vision, I'm grateful, I'm thankful, and you know, I work with Kim pretty closely. Anything you need, um, this is phenomenal. So we're in your corner, definitely. Thank you for being here for us.
Thank you so much for acknowledging that. I really appreciate it. Like I said, this was a personal, start for me. And so I'm very passionate about it. This is not a game. And,
Yes.
this is I came out of what I thought was my comfort zone working at the law firm. I thought I was gonna retire there, and then, to come over into this space. But, it was my God-given purpose that I didn't know that path that I was uh embarking on, that was, I was put in, I should say, was creating this. So my pain became someone else's blessing. And this was, the purpose that God planned for me and my path. So, I just follow his lead. I don't know, just I do what I do. And I enjoy it every day I get up. No 2 days are alike. But as long as I can keep my doors open and keep great staff to do the work that is needed to be done, and I can, battles are here to be won. So thank you so much, and I look forward to, uh, giving you all the information that you need so that you can get it out to the community and let the community know that this is here. Because if they don't know what they have, they will not use it.
Absolutely, absolutely. And I just really want to echo everybody's sentiment, Dr. Green. We are so blessed to have you this morning and to get this information. And you have touched everybody on the call. So I appreciate your dedication and for you sticking it out over these years and growing and just blossoming the Lincoln Option Center to something that is so much needed. And hopefully you'll be able to join us next month. We do meet every third Thursday. We meet by Zoom, and we are looking to have a few in-person meetings this year, but we do
Okay.
religiously meet by Zoom. I do want to share just a couple of announcements before we go. We have partnered with NAMI Illinois to do the Sharing Hope. It is community conversations around mental health, and we're in the process of wrapping up the first one. focused on having these conversations with Black women, and Sharing Hope is specifically for the Black community. And we're really excited. Definitely something that we intend to continue to do. So if anybody wants to host a Sharing Hope, we do 2 sessions by Zoom, and then we do the third session is in person. And we pair that session with some sort of creative art project. This month, we're doing creative journaling. I would also like to invite you to support the Lincoln School Leo Club. They are having their 3rd annual induction ceremony and banquet. It's going to be on May the 18th. It's going to be at the Inger Brothers VFW in Calumet City. And as part of their service project, they are collecting hygiene products that they would like to make available to their peers as well as to the homeless population. So we have a short list of some items such as deodorant, body wash, soap, face towels, toothpaste, and so on and so forth. So this is a project that the kids thought of because they say it's a need in their school. So I will share that information out with the hopes that we can help them do a really nice collection. The school usually has a back to school event in August. And so we usually have a table with them so that they can give out these items as well as have them on hand. We also do a pop-up closet. So if anybody is in need of clothing, we have men's and women's clothing. We have some shoes, and we will come drop it off. We don't have the capacity to send people to get stuff, but one of the things that we've done is actually go to the location and we set everything up. We bring the coat racks, we bring the hangers, we bring the outfits, and we let people come in and shop, and they can have as much as they want because the donations keep coming. And I must say, we get some nice stuff. So we would love to bring that to you. And of course, if you have any announcements, we try to get the meeting notices out at least a week and a half before the meeting. So if you have anything that's going to be happening, please send me an email. You can send me your flyer, and I'll try to get it incorporated into our meeting notice. And I will also share my email in the chat box.
Can I share one last thing? I know you're
Yes,
about
ma'am.
out of time. So when it comes to our doula program, know that it's not just for adults. We have a lot of pregnant teens in this area.
Yes.
So please reach out. It's for anyone that is pregnant, but we have the data to show that there are a lot of pregnant teens in the South suburban area that either are not seeking any prenatal care or they're getting it late. So you know what that means, right?
Yes. Yes. Yes.
And
Yeah,
we
I
are
know a
trying
few
to
of the
make.
schools have daycares now.
Yeah. So just know that is something to keep on your radar when you're talking to people. Okay.
We appreciate it, and I will definitely keep you guys abreast. We've been getting more information about other network meetings and community meetings that are coming up. So I will be sharing those out as they come so that, we can kind of make sure that we're making our rounds and spreading all this good information. And so if we don't have any more announcements, I would love to thank everybody for showing up today. Thank you for being engaging. Thank you, Dr. Green. Thank you, Eve, for all of your wealth of knowledge. And I will return you guys back to the rest of your day.
Thank you so much. It was
All right.
nice meeting all of you. See you next month.
All right. Have a great afternoon.
Okay. Bye.